for joining for another session of Student Development Program brought to you by Eduko Pathways. As always, we have our valued partner, University of Nottingham, Malaysia, today with us. And let me introduce shortly Dr. Georgina Marsh with us today, who would be hosting this session and taking this workshop. Georgina Marsh is a UK registered pharmacist with experience working in both industry and academia, having gained a master's degree with honors, first class degree from University of Nottingham, UK in 2012. She is now the assistant professor in pharmaceutics at the University of Nottingham, Malaysia. Georgina's research focus on development of novel dosage forms tailored to the needs of the patient. One of the main avenues of the research involves the 3D printing, additive manufacturing of pharmaceuticals. She'll be talking about why biomedical science and the subject itself is so globally recognized and so globally wanted, and the future of it all. So without any further ado, over to you, Dr. Georgina Marsh.
Perfect, thank you very much. I'll just share my screen. So good morning, everyone. So thank you very much for tuning in. So as has just been said, my name is Dr. Georgina Marsh, and I'm an assistant professor for the University of Nottingham, Malaysia. So my talk today is really going to be looking at some of the skills that you pick up in biomedical and pharmacy programs and why they are so relevant now and so sought after in employability. Okay, so a little bit about the University of Nottingham. So we have 3 campuses. So obviously it was originally founded in Nottingham, UK, in the United Kingdom. In about 1881, but since then it's really looked globally in trying to engage obviously the world in its education and research. So it set up a campus in 𝐄𝐈𝐎𝐌𝐄𝐃 in Malaysia, which you can see a little picture at the bottom, and it also set up a campus in Ningbo in China. So the University of Nottingham, Malaysia is a campus about 40 kilometers south of Kuala Lumpur, so the capital in Malaysia. And as you can see, this is kind of a drone shot of the campus. It has 2 faculties and 18 departments. And you can see that it's set in a lovely location in the middle of a palm tree. So I just thought I'd give you a little bit of background about where I'm lucky enough to work at the moment. So a little bit about my career. So as has already been stated, I did my MPharm degree, so that's a 4-year program in Nottingham, UK. And then I went on to register as a pharmacist in the UK, split between industry and hospital. I then followed that up with my PhD back at the University of Nottingham, looking at 3D printing of micron scale topographies. And then I went on and did 2 years in industry as a senior formulation scientist at 𝐴𝑠₂. And then I started my current role as an assistant professor in the School of Pharmacy at the University of Nottingham, Malaysia. So as you can see, I've kind of had a bit of a already varied career. I'm still quite junior in my career, but I've worked in various different areas. And I think all the way through, it's really become apparent to me how the skills that you pick up in pharmacy and biomedical sciences are so relevant to different parts of your career. So I suppose, first of all, what is pharmacy and biomedical sciences? What am I kind of really discussing? So these are both courses which require really strong scientific knowledge, and then they are focused on clinical areas. And it's understanding how disease states work, understanding how different medicines and drugs interact with those disease states, and helping to develop and optimize them. So the pharmacist is obviously looking at it from a medicine perspective, and they're really integrating that science, but in the view of the patient. So they're thinking about how can we use the scientific knowledge, apply it to the medicines, and then help to optimize the treatment for our patients that we have. Biomedical sciences is looking on the focus of the actual diseases. So they're looking at the differences in, for instance, physiology between healthy individuals and disease states. So that's just to give you a little bit of a background of what these courses are that I'm discussing today. So why is it relevant? What's the future looking like? Well, at the moment, the pharmaceutical and healthcare market is expected to grow at a compound annual rate of 4% in the next 6 years. So that means every year it's expected to grow by 4%. So you can see it's a growing and expanding industry to get into. So by the time that you'll probably be finishing your degrees and starting to enter the workplace, you can see the industry is going to be even more successful than it is at the moment. And one of the reasons behind that is actually the population growth. By 2050, is expected to have a global population of 9.7 billion. So you can see at the moment, we're nearly 7.7 billion. So in the next 30 years, we're going to be almost an extra third. And so that presents lots of challenges for the healthcare industry, because all of those people will have different illnesses, different diseases. We're likely to have more and more emerging diseases. And with the life expectancy increasing, especially with the greatest growth rate in the over 65s, these diseases that we're going to be treating are becoming more and more complex. So that means whereas previously, maybe in the 20th century, a lot of people were dying of things, for instance, infections, where they became ill and then died quite quickly. Now there's more and more people that are suffering from diseases that actually they'll have for a significant proportion of their life. And so that means that they require a lot of interventions from healthcare professionals. So really require a lot more of the industry, a lot more cures, a lot more interactions with healthcare professionals. So that's why actually pharmacy and biomedical sciences are really good professions to be getting into at the moment. So why is healthcare relevant today? What's going on in the world where we think actually we really need healthcare professionals? Well, I suppose the most obvious is all the emerging diseases we've seen in the last 10, 15 years.
The World Health Organization described the new coronavirus as a pandemic for the first time on Wednesday, adding that Italy and Iran were now on the front line of the disease and other countries would soon join them.
So I'm sure we're all aware that we're currently living in a pandemic. It's affected everyone's life, but actually having the knowledge about pharmacy and biomedical sciences has really become essential in the last 18 months. And actually it's become everyday topics. So people that maybe aren't scientists, maybe have very little knowledge about kind of human healthcare, are suddenly wanting a lot of information about diseases, about viruses, about treatments, how effective they are. And that's all the knowledge that you gain as part of pharmacy and biomedical sciences. So during the pandemic, biomedical scientists, pharmaceutical scientists, first of all, were involved in understanding the structure of the virus, understanding its makeup, how it spreads, looking at it in a laboratory, trying to develop, for instance, vaccines. Pharmaceutical scientists and pharmacists work in industry in order to create the vaccines that we're all hopefully being vaccinated with at the moment. Pharmacists are really on the front line, talking to the everyday public, talking to patients and explaining different risks of the virus, how to protect yourself. So for instance, wearing a mask, sanitizing regularly, social distancing, all of that kind of public health knowledge, pharmacists are the best placed to actually share with the general public. They also are there to help advise people who might be concerned. Have I got COVID? How do I stop from spreading it to my friends and family? What's going to happen? What are my symptoms likely to be? Biomedical scientists, as I said, they're really looking at the changes that occur in disease states. So they're going to be looking at what happens to the lungs in COVID. They're going to be the people that are identifying the different changes that we might be seeing and helping to identify different treatments, different recommendations in order to help people to have less severe treatments, less severe symptoms. Testing. Well, biomedical scientists, pharmaceutical scientists, and pharmacists are all going to be involved in, for instance, developing test kits, the PCR, as I'm sure most of you have heard about. That's all going to be tested in a laboratory with people from various different skill sets of pharmacy and biomedical sciences. People can also go into pharmacies and buy those test kits themselves. Then you've obviously got the vaccines themselves, what we've all been using recently. Those, as I said, will be developed in pharmaceutical industry, often by pharmacists or pharmaceutical scientists. And actually they're being administered in a lot of countries like the United Kingdom by pharmacists on the front line. So you can see that pharmacy and biomedical sciences actually has been involved in the whole kind of life cycle of COVID at the moment. And so it's really crucial in the pandemic, having these sort of skill sets. So that's kind of the knowledge. And these are the obvious careers that you can take from pharmacy and biomedical sciences. However, what I'm going to talk about later is some of the skills that you'll gain that actually allow you to participate in whole ranges of different careers. So first of all, obvious careers for pharmacists is being a pharmacist. So there's various different sectors that you can work in as a pharmacist. So whether it's community pharmacy, so that's like retail, on the high street, for instance, dealing with prescriptions, giving patients advice. In a hospital, as its name suggests, hospital pharmacy, you're going to be on the wards dealing with patients who are inpatients or even outpatient patients. Industrial pharmacy is involved in the development of the medicines, looking at drug discovery, turning those into medicines. Primary care pharmacy, so working with doctors in close proximity, helping to come up with guidelines for areas. But there's also lots of other kind of areas that people don't often think about when it comes to pharmacy. Being an academic like myself, so working and lecturing in a university. Being a vet, so thinking about medicine for animals. Joining the military as a military pharmacist. Regulatory affairs, so approval of vaccines, that will all be reviewed by pharmacists. And also working in care homes and prisons, looking at optimizing the treatment for people that are currently in those institutions. Pharmaceutical scientists obviously work in industry. So these are some of the industrial companies that our graduates have worked in. And they can work from anything from being a formulation scientist, so that's taking the drug and turning it into a medicine, or actually a quality assurance specialist who looks at analyzing the quality of what's being produced, making sure it meets the standards, making sure that it's safe in order to give to patients. Biomedical scientists will focus more on medical research, and that can be universities and government agencies, or indeed in industry as well, like for instance, GSK and Nestle. A lot of people also do biomedical sciences as an entry route into medicine. So if you want to be a doctor, you can do biomedical sciences first and then do a conversion. However, doing a pharmacy and biomedical sciences course is not just about the knowledge. It's also about the transferable skills that you gain. And this is why that pharmacy and biomedical sciences graduates are so highly sought after. So what I'm going to do is I'm going to take you through a few kind of top soft skills and transferable skills that you kind of get as part of your pharmacy and biomedical sciences degree, and kind of explain why they're so desirable to employers. So first of all, working with others, working as a team. So if you look at here, these kind of statistics that I took off of an employability website, and you can see that teamwork is #1 on the list. It's the most highly desirable skill for future employers. And that's because in everyday life, we're always working in a team, whether that's a project where everyone has to come together to complete the project for a set timeline, or whether that's working with lots of different industries and lots of different partner companies and needing to work as a team in order to coordinate effectively. And with this increasingly global world, with people working in different countries and traveling all around the world, it's really important that you have this skill set that you can work with different people and look at the kind of team's complexity and think about everyone's strengths and weaknesses. And when we think about kind of diseases and how they're progressing, we also think about global issues like climate change, for instance. These are all really complex, interdisciplinary problems. So they require not just a pharmacist, not just a physicist, maybe an environmental scientist, maybe someone from a completely different, not even a scientist. They all have to be able to work together and use their strengths to solve the problem. And that's what pharmacy and biomedical sciences teaches you. We're doing interprofessional learning, where you'll be learning with, for instance, doctors and physios, doing group case studies, so having a patient, looking at their kind of case and trying to solve the kind of treatment plan for that particular patient. Joint lab tasks. So if you're having a laboratory practical, you'll be working sometimes in a team where you'll all have different tasks that you have to complete in order to work together to collect the data, analyze it as a group, and then present it as a report. So you can see that there's lots of different opportunities in all of the courses for you to build up these expertise. So when it comes to an interview, and even if you're not going into pharmacy and biomedical sciences, and they say, give an example of when you've worked as a team, there's so many opportunities that you can then discuss, which really sets you ahead of other people. Critical analysis. So this is really relevant, I think, today more than ever. So this is about looking at kind of information and judging the sources of that information. Thinking about the accuracy of the claims. Is it reliable? Is it something you can trust? So I suppose those of you that follow the news will have probably heard the term fake news. And that's going around everywhere at the moment. So are people giving you misinformation? Are people misleading you? Are people telling you things that aren't true? Well, all of that is about people having access to lots of information on the internet nowadays. But are they actually analyzing what they're seeing? Are they thinking about whether or not these claims are legitimate? And that's what the critical analysis skills teach you. So you can see that just in your everyday life, when you kind of go onto the internet, when you watch something on YouTube, it's about understanding, is that actually valid? Is that something I can trust? I'm sure you've all watched kind of debunking life hacks videos where they look at kind of tricks and then go, but do they actually work? Are they safe? Is that plausible? And they analyze the videos and take apart whether or not they work or not. And that's because they're using critical analysis skills. They're trying to figure out, is this actually trustworthy? Is this something people should be following? And we have a whole range of different opportunities for students to practice and develop those skills on the courses. So whether that's a journal review, so taking an article in your field, analyzing it and looking at its strengths and limitations. Has it got anything that maybe the methodology is not quite right, anything that could be perfected, where you think actually maybe the kind of conclusions aren't quite what they're actually drawing based on the results they've gathered? Or have discussion classes where maybe there's a topic or an ethical dilemma, and you all have to get together and discuss how to approach it and discuss whether, you know, different approaches are actually valid or not. Looking at patient notes. So what different people have written down, is that the treatment that they were trying to do? How, is it evidence-based? Is that the right approach for that patient? All of that requires critical analyst skills. And again, manufacturing reports. So when you've done something, you've manufactured something, has the process been quite right? Has every step gone to plan? Is there any kind of concerns? Is there anything that would stop you from actually using that data or using that product in real people? Innovation and problem solving. So this is something that I think everyone can see all the time. So whether it's just, you know, day-to-day life and you've got an issue in your house and you need to solve that problem, or whether that's you want to start up your own company, you want to go on Dragon's Den and be the next inventor. You need to be able to think about problems and come up with innovative solutions. And actually, pharmacy and biomedical sciences, it may not seem like an obvious fit, but actually it's really important, being a pharmacist, is looking at kind of scenarios, looking at real world case studies and thinking, how can I solve this problem? What medicines might help the patient? What understanding of a disease will really help me to find the next best cure? Formulation is all about obviously looking at a drug and turning it into a medicine. So thinking about different opportunities, different options, and trying to innovate new ways of formulating something in order to give the best patient care. Whenever you go into the lab, you're going to be designing experiments. So again, if we give you a task, if we give you an end goal, can you design something that's going to have a series of different activities in order to meet those objectives? And computer modeling, so looking at how things fit, understanding how things interact. Are you able to solve those problems? Are you able to innovate new ways of developing medicines, or for instance, combining known drugs in order to solve the problem? So actually these skills are things that are built up throughout the course, but can be easily applied to other areas of your career. And this is just kind of a quote from an employability skills website. And as you can see, it shows that problem solving and innovation is actually about showing a range of different competencies. So resilience, being able to bounce back, being able to solve problems that maybe are unexpectedly thrown your way. Lateral thinking, so thinking outside of the box, not thinking the same way that everyone else thinks. All of these are really important in kind of the workplace today, as people don't want people that are just following what everyone else has done. They want people that can come up with new solutions, that can think about new ways of approaching tasks. Communication skills. So it may seem very obvious, but actually communication is all around us. What I'm doing to you right now is communicating. I'm spreading my message. I'm helping you to understand a different topic. And actually in the pandemic, good communication skills have been vital. Where previously maybe you could just go and talk to a person, now you have to actually communicate using an online forum. So being able to adapt to different communication technologies in the future, who knows how we'll be communicating with other people. And so, you know, whether you're going into pharmaceutical industry, or you're going into manufacturing or any other kind of industry, actually being able to communicate what you're doing, what you're interested in, what your ideas are, how you're helping to solve problems to the general public is what makes things a success. So whether that's a company website, getting the branding right, helping to draw people in, you know, communicating things that people are interested in, or whether that's things like Facebook or YouTube and producing social media content in order to let people know what's going on, advertise different messages. All of that's about good communication skills. And there's lots of opportunities for people to pick those up as part of the course. So you can have, for instance, presentations where you have to present your ideas. So say you've done some research in the lab, now present them to other people. Take something that might be complicated, that might be complex, put it in a simple way so that other people who haven't done your project can understand. We also do role plays with students where, for instance, students will play patients or pharmacists. And so learn to communicate to different types of people, learn how to express themselves both verbally, but also using non-verbal cues. Writing. Now, this may not seem like the most exciting part of the course, but actually having good written skills is important, whether that's writing a press release on the internet, writing an essay, dissertation, or whether that's writing an email to a colleague. All of these are really important communication skills that are vital for your future career. So you can see some of our students here practicing some of these various different skills. And you can see, obviously, at the bottom right, you can see people, bottom left, sorry, you can see people on Zoom having to present as a team using kind of Zooms and Teams. Finally, numeracy skills. So this maybe is not the most obvious kind of transferable soft skill, but actually in pharmacy and biomedical sciences, it's vitally important because it's really about ensuring that patients are not over or underdosed, thinking about organ functions and whether things are efficient or not, data analysis. But actually in the world around you, you're actually surprisingly surrounded with numeracy all the time. If you think about the pandemic now, everyone's always talking about cases. Are they going up? Are they going down? What's the R value? What's the vaccine effectiveness? What's the kind of error in the studies? All of that's about understanding numeracy, understanding statistics. And actually one of the massive topics that people are interested in now and a real boom kind of career path is looking at big data. So analyzing lots of different internet streams, collecting data from various sources, and over kind of millions of people looking at kind of trends and using that to help guide people and improve different lives. Now, actually, pharmacists may seem like not an obvious fit for that, But as part of our understanding of trends, understanding of clinical trials, understanding of kind of statistics, that really gives you a great foundation if you want to enter something like that and use that as your basis for your career. So it's not just about the knowledge. Pharmacy and biomedical sciences, yes, the knowledge is vitally important at the moment. Yes, it's a great career in itself, but actually it's really important for a whole range of different careers. So these are just some of the ones that I've thought of with those 5 skill sets. So working with others, do you want to become an event planner? So you have to coordinate the person who sets up the location where the event's happening, maybe the catering, maybe the kind of guests. You've got to work with a whole range of different people and use that skill set in order to make sure everything comes together at the right time. Working in a think tank, working with people from different backgrounds, different disciplines, helping to solve problems that are often very complex. Being a politician, I know it sounds a little bit funny, but actually politicians are at least meant to work with other people. Whether or not, I'll leave that up to you. But obviously they're working together, you know, in a government, in parliament, in order to try and solve problems and hopefully work with their community. Critical analysis. So being a policy advisor to the government. So this is all about looking at trends, looking at global perspectives and giving advice to the government on, for instance, how to prepare, how to plan, what the future might look like. And so what we might need in order to solve problems that might be coming in the horizon. Being a patent attorney. So this is being a type of lawyer, but these are lawyers that specialize in protecting ideas. And actually, when you become a patent attorney, it's all about understanding the idea, understanding all the subsections and helping to draft a patent in order to protect the idea so that people can't find loopholes and create something very similar without violating the patent. So being able to critically analyze things that people are presenting as ideas is really important. Being a criminologist, so understanding a crime, understanding the mentality of a criminal. These are, again, all things that require critical analysis. You have to think about what's actually happened, why it happened. Is the kind of story that maybe the person who's being accused of the crime, is that viable? Does that make sense? That all requires those critical thinking skills. Innovation and problem solving. So obviously the obvious one is being an entrepreneur, coming up with an idea, starting your own startup company. But actually as a researcher, you're coming across things that have never been done before. You've got to use kind of existing knowledge and apply them to that task. So can you think about outside the box? Can you think of maybe using a method that you haven't kind of seen used that way before, but will that help to solve the problem? Help you to get more data that can give you insight into what you're thinking about? Being a computer programmer, so coding, IT, thinking about the logic, thinking about how you can solve a problem, design a code in order to do what you're hoping to achieve. Public affairs. So this is about communicating with the public, but also managing maybe problems, issues, and helping to guide people on how to approach different things, how to spin it out to the public in a way that maybe doesn't have as much damage. Communication. So this is obviously a skill set that's used in every career. But some obvious ones is being an academic. What I'm doing now, communicating. My job at the moment is a lot of lecturing. I teach students. And so that's all communication skills. Going into branding. So you're interested in marketing. Are you interested in, you know, advertising things, changing different kind of events so that they really appeal to the public? That's all communication skills as well. Looking in medical sales, being a scientific journalist. So do you want to be on TV and take kind of complex scientific matters and then spread them with the public so that everyday person can understand it? And finally, numeracy skills. So do you want to be a statistician? Do you want to be an accountant or a stockbroker? That's all about understanding the numbers, understanding the statistics, and helping to apply that in your future career. So pharmacy and biomedical sciences, yes, They are vocations. Yes, they are careers where you can become a healthcare professional, but actually they're also a strong science subject. And that's used in a whole range of different careers, where actually what they want is someone who's a logical thinker, thinks critically, but can also communicate and work with others. And that's why pharmacy and biomedical sciences really have a strong skill set that you can use for your future career. So these are what a couple of students have said about kind of courses doing pharmacy and biomedical sciences. So in our course in pharmacy, they have the opportunity to actually run a kind of simulated pharmacy. So they kind of mock it up, they work as a team, and then they have kind of patients who are pretend patients coming in with various different illnesses, looking for advice, looking for prescriptions. They might have healthcare professionals phoning with issues. And so all of that will obviously develop their communication skills, their ability to work in a team, problem solving. Maybe someone's asked for something, they don't have it in stock. How are they going to supply the patient? How are they going to help that patient? Is there anything else they can ask or anything else they can suggest? Pharmaceutical sciences, there's a lot of experience in the lab. So Chin did a kind of lab placement in the summer, and he had to design and implement his own experiments. And so for him, he really learned a lot about planning and executing, but also about working independently and then presenting his results. As you can see, he produced a poster of his project. So I'm just going to round up with just a little bit about our programs at the School of Pharmacy at University of Nottingham, Malaysia. So if you are interested in obviously either coming for a placement or indeed coming and studying at the University of Nottingham, this gives you a bit of an insight in what we cover. So the School of Pharmacy was obviously originally started in the United Kingdom, and we're currently ranked 5th in the world in the QS 2021 rankings, and top in the UK for pharmacy alone. So in Malaysia, we established the School of Pharmacy in 2005, and we are the first and longest running 2+2 MPharm program in Malaysia. So what that means is you study 2 years in Malaysia and then 2 years in the UK. So you can work as either a pharmacist in the UK or indeed in Malaysia. We run 3 different programs. So Pharmaceutical and Health Sciences, which is a 3-year course. And this is really aimed at students who are interested in a career in pharmaceutical industry, in research, has the opportunity to study in the UK for a semester for a research project, and really requires strong chemistry knowledge. Master of Pharmacy, which is the course if you want to become a registered pharmacist. That's a 4-year course, 2 years in Malaysia, 2 years in the UK, but requires strong biology and chemistry. You have to understand about the human biology, as well as understanding about the drugs and the chemistry and how those two work together in order to optimize patient treatment. Finally, Biomedical Sciences. This is a 3-year course, and you can either study the 2nd or the 3rd year in the UK. And these are for people interested in medical research. Again, it requires strong biology and chemistry, as it's about understanding the processes going on in the human body, really understanding the physiology, but also the chemical pathways and how these things can go awry in disease states. Just quickly, what's the difference between pharmaceutical and health sciences and MPharm? So pharmaceutical and health sciences has chemistry, biosciences, pharmaceutics, and the Master of Pharmacy program requires all of this, but also that added element of interacting with a patient, communicating the outcomes, helping the patient to devise treatments. So that's that added extra of pharmacy practice. Throughout your course, we'll obviously help you in finding a career that suits you, whether that's doing employability roadshows, giving career talks, helping with advice for interviews. There's a whole range of different guidance and advice that people will receive throughout the courses, whichever program you choose to take. So just to leave you with this thought, could this be you? Have a think. Any questions, I'm happy to answer them. Thank you very much for listening.
Thank you, ma'am.
Thank you, Dr. Georgina Marsh, for such an amazing presentation. We have more than 100 participants today. So that clearly shows the interest of pharmacy in Bangladesh as well. Also like to take this opportunity to thank 𝐿𝐴𝐿𝐴𝐻𝐿 International Student Recruitment from University of Nottingham, Malaysia. Thank you, Z, for organizing such a great event, and want to congratulate you. There might be a lot of questions here. I think we can open the field to any questions. Anybody who would have any particular questions for Dr. Georgina Marsh is more than welcome to unmute themselves and ask the question. You might also raise your hand if you know how to do that. And then we would be able to pick one at a time and help Dr. Georgina Marsh answer your questions again. Just to let you guys know, for the certifications, you'll have to answer about what you learned from this program, along with your email address, phone number, and all that. It's in the chat. Just click on the link and you have to submit that feedback form in order for you to get that certification from University of Nottingham, Malaysia. So we are open for questions. Anybody who would like to ask anything?
Hello, sir.
Please go ahead.
Oh, sorry. You continue, ma'am.
No, go ahead.
No, it's okay. No problem. You continue, ma'am.
No, I was just saying there were some questions in the chat, but as you've raised your hand, you go ahead.
Oh, no problem. Hello, ma'am. How are you?
Very well, thank you. How are you?
I'm fine. I'm Sam from Chittagong Polytechnic Institute, and I completed a diploma engineering from power technology. I live in Chittagong. I want to know about this event. Actually, I don't know about this event. I just joined it now. I think I missed some your lecture in within half hour.
Okay, so obviously I think the recording will be available online for you to watch in your own time. So basically this has been a talk about the skills that pharmacy and biomedical scientists pick up during their degree, and how this can be beneficial in a whole range of different careers. So feel free to obviously watch it online, and if you have any questions after watching it, then obviously feel free to either rejoin or send a question afterwards.
I have also a question. Hello.
Hi.
Go ahead, Mainur, go ahead. We can hear you.
Currently, I'm pursuing my B.Pharm from university, that is Asha University. So can I continue my last 3 semesters from Malaysia? Is it possible there?
So you're already on a B.Pharm course. So you wouldn't be able to swap to our MPharm with a straight swap. But we do have some links with some universities regarding doing, for instance, a research project. So, but if you're interested in after your B.Pharm doing, for instance, a master's or indeed a PhD, then obviously at that point, feel free to get in contact with us and you can obviously continue your education in Malaysia. You can't change courses mid-course to an MPharm because obviously it's accredited by both the UK and Malaysia. So you have to make sure you meet certain kind of criteria throughout the course. Hope that answers your question.
Ma'am, can I ask one question, please?
Sure.
Ma'am, can I study this subject from my country?
So we will be online for the beginning of this year, but the whole course is not online. So obviously this is just online at the moment because of COVID. However, when things hopefully start to open up and universities go back to being in person, it is an in-person course. It's really essential, for instance, that you do labs, that you have interaction with patients, and all of these have to happen in person. So obviously we welcome people from other countries, but you would actually have to come over to Malaysia.
I also asked a question.
Yes.
Why Masters of Pharmacy is 4 years?
So the Master of Pharmacy course is a 4-year course. It's an undergraduate course, so it takes you from kind of school level to becoming an accredited pharmacist. So the reason it's 4 years is because in the UK, it's important that people have a 4-year training in order to become a pharmacist, followed by a year on the job training. And so it's a 4 years, but it's an integrated master's, so you'll come out with an MPharm. So a lot of places obviously have BPharm, so that's a Bachelor of Pharmacy, which will be 3 years often, whereas the MPharm allows you to do 4 years and come out with a Master of Pharmacy.
Just 1 second, Mohammed Nasir, if you're there, you had a question, you raised your hand a long time ago. If you're there.
I think that's who just asked about the 4-year MPharm.
Okay.
Yeah.
Yeah, go ahead, Mohammed Nasir. Yeah. You're done? Okay, next. Anybody
Hello.
next? Yeah, go ahead.
Hello. Yes, I am Abdul Ahad from Dhaka, but I have a question. Actually, my background is not a pharmaceutical background, but I really have a chance to take the course in pharmaceutical course, in a short course that will help for me in the future career.
So if you're interested in doing, for instance, a master's, so for instance, the UK does a master's, and if you've got a scientific background, then you can often enter a kind of a pharmaceutical, for instance, master's program. There are places, not Nottingham, but there are other places that do kind of more like in terms of diplomas or short courses that give you insight into different areas. But if you want to be a pharmacist, you have to do a pharmacy degree. So it depends on what you're interested in. Obviously, again, for biomedical sciences, again, there are masters available. If you've got a degree in a science that's maybe not biomedical sciences, but something similar, or you can obviously enroll on a 3-year biomedical sciences degree.
Mohammed Mizanur Rahman, do you have a question? If you could unmute yourself, MD Mizanur Rahman.
Yes.
Yeah, go ahead.
Hello, ma'am. I have a question. I complete higher secondary. I want to study for undergraduate in your university. Is it only self-financial, or you provide any scholarship?
Susie, do you want to answer about scholarships?
Okay. The university does offer scholarship, but it will depend on the qualification that you come from. So you mentioned that you just complete your HSC, is that right? So for HSC currently, we do not offer any scholarship, but you can join our foundation program, and if you've done very well in the first year, the next year you can get the 25% scholarship that is under our Dean Excellence Scholarship. So if you want to do MPharm or biomedical science, you will need to do a foundation in science first, and then you can progress to MPharm or biomedical science. For more information on how to apply to Nottingham, Malaysia, you can also get to our representative, Eduko. They can help you with the application and answer any question about application. I hope that answered your question.
Yeah, ma'am. Thank you so much. I got the answer.
All right. Thank you.
Thanks, Z. So next is Angelina Nodi Francis. Can you please unmute yourself and ask a question?
Good morning, Dr. Georgina Marsh.
Hi there.
I hope you're doing well. Okay, I had this one question that after the 4-year course that we're doing at the university, do we get to do an internship program, or do we get to interact with patients during the years when we are studying biomedical in the university?
So for the pharmacy course, there will be various different placements as you go through the 4 years. So you will obviously get to interact with patients both in a hospital setting and a community pharmacy setting. And these placements are of varying different lengths. In the Biomedical Sciences course, there's an integrated placement at the end of your second year, where depending on what you're interested in, depending on whether or not you're actually as a researcher in a lab, or whether or not you're interested in something more clinical, will depend on whether or not you interact with patients. At the end of an MPharm program, there is a year on the job training. This has to be at least 6 months in a clinical setting. So that means at least 6 months of it have to be interacting with patients and kind of providing advice. And then you'll be assessed as part of that, looking at kind of competency skills, but also at your kind of general knowledge base in order to register as a pharmacist. So it's so there's lots of opportunities for you to obviously meet patients and interact with patients in both kind of biomedical sciences and pharmacy. Hope that answers your question.
Thank you very much.
No problem.
Okay.
Mustafizu, do you have a question? Yeah, Z, go ahead.
Okay, just a quick one, because there is a question that is related to what Angelina asked. So I think, is registration mandatory for being a pharmacist? Is it, if so, is it done before completing undergraduate or after? So I think Dr. Georgina, you answered that there is a placement after the student complete.
Yes, Nottingham UK also do an integrated 5-year placement. So you can start with the normal MPharm and do 6 months during the course and 6 months after the course. And so at the end of the 5 years, you'll then be registered in the UK. Obviously, what's beneficial about our kind of MPharm program in Malaysia is you can also have the option of doing a year on the job training in Malaysia to qualify as a Malaysian pharmacist as well. So, but both obviously require you to do that kind of year's training in order to be a pharmacist.
Great. Let's move on to Mustafizu. Mustafizu, do you have a question? Please go ahead.
Hello. Good morning, Dr. Georgina Marsh. And Assalamu alaikum to everyone here. Am I audible?
Yes.
It's here.
So, ma'am, you mentioned about R value in one of your slides, and I'm currently involved in a research project where I'm also investigating values and also proving them based on statistics. So could you please tell me if R values are related to P values or false discovery rate, or it's a completely different concept?
Well, I have to say that's not really my area of expertise. I kind of look at more in terms of the formulation. I suppose from my presentation, what I was talking about is more about understanding what an R value is and how it can be applied to kind of everyday life. So you're probably better off looking at kind of a virologist or a statistician to kind of understand the differences. I wouldn't want to kind of give you something that wasn't quite right. So apologies for that, but that's probably not really my area.
No problem, ma'am. Thank you so much for the direction as usual. Thank you so much. Have a nice day.
You too.
Shahidul Islam, can you please unmute yourself and ask your question?
Yeah. Assalamu alaikum. I'm Shahidul Islam from Savar. So I'm a current student in pharmacy department at Kono University. So I want to know about MPharm degree in university in your university. So will I be able to get MPharm degree from your university and with the scholarship? And I'm going to become a graduate in next year. So is it possible to get MPharm degree with scholarship?
So if you're already becoming a graduate, I suppose the first thing is that our Master of Pharmacy is usually designed for people that haven't already done a degree, but you can obviously go into the Master of Pharmacy from a degree. I think Susie would probably be able to tell you a little bit more about whether or not the scholarships and what scholarships are available for people who've already graduated.
Yeah, I think since you say that you graduate with a bachelor and you want to do a postgraduate, but for our postgraduate in Nottingham, Malaysia, is a research based. So you will need to have a research proposal first, and also the school will inform you whether we can find a suitable supervisor. As for the scholarship, it will also depend whether the faculty will have. It will depend on the faculty based on your proposal. But I mean, if you are thinking to transfer, our MPharm, there is no transfer option. Student must start the first year in Nottingham, Malaysia. There is no transfer to second year or third year option for MPharm.
Great, thanks, Z.
What requirements do you want for this course? Please tell me.
What do you, it depends on your qualification. Are you studying from A level or are you studying in a Bangladeshi high school?
Yeah, I have completed my high school, and then I have completed my college degree. Okay, with 60% above marks, and then I have admitted in the university, 𝐵𝑗𝑗 University in pharmacy department, and I'm currently in 6th semester.
Okay, I think maybe you can talk to one of the counselor, show them your transcript, they can advise you, they can then forward your inquiry to me, we will check for you.
Yeah, Shahidul Islam, okay? Just get in touch with us, we'll help you with the process, okay? Our information and how to get in touch with us is on our Facebook page or on our social page, so just, or you can also find it in the chat box, okay? So we'll talk in detail. Our counselor will help more in detail. So next is Mustafizu Rahman. Mustafizu Rahman, can you please unmute yourself and ask the question? Go ahead.
Thank you for giving me time. Actually, I'm from Bangladesh and I'm a professional. I'm doing work in NGO sector in Bangladesh. The name of my NGO is Rupantor. You know, we have a lot of social issue, directly not health issue, but we have a lot of related issue, link issue like COVID-19 sports or such kind of issues. Actually, I'm very pleased to join here. It's a great opportunity for me. So I have a question just, have you any plan next to arrange the same seminar? Will be helped from the field. Actually, I'm very happy. So have you any plan? Just a question.
Mustafizu Rahman, just to answer you that question, we'll always be having these student development programs carrying on. Maybe the subject will not be pharmacy. We'll talk about some other subject which is of similar area of interest for our students, and also depends upon which faculty or which person would like to host the session, or which university would like to host the session. Please, thank you so much for your comments. Please do follow us on our page. You'll get to
obviously I follow you.
Yeah, great. So you'll get notified of any further future SDP sessions. Angelina Nodi Francis, do you have another question? Please go ahead.
Yes, I do. Hello, doctor. As you have mentioned that before taking up medicine in university level, we can do the course of biomedical sciences. How long will that course be?
So biomedical sciences is a 3-year course, and then you would do graduate entry medicine. Susie, do you know how long the graduate entry part of the medicine course is? Is it another 2 years?
Okay, I'm not sure about that because you have to do it in our Nottingham, UK. And as far as I know that not all, you have to check with a certain university. So for Nottingham, UK will accept our biomedical science to go into the graduate medical school, but not For other university, you may need to check with them first. So I'm not sure how long they graduate, but I would say maybe definitely more than 1 year, because if you do a medical course, it easily 6 year and 7 year plus the training and everything. So biomedical can be considered like a pre-med. And then if you are interested to become a doctor after you complete the biomedical science, then you can go do the graduate entry. The more information can be found on our Nottingham UK website. So let us, you can find more detail there.
Thank you very much.
Sana Nawab, can you please unmute yourself and ask the question?
Good morning to everyone. My question for ma'am is that I want to know whether for being a pharmacist, we all have to complete a registration form, and then we would be known as a pharmacist and will be allowed to work in different laboratories and in different research and development programs. So I just want to know that in Malaysia and in other Western countries, as for example, UK, do we have to complete the registration before undergraduation or after undergraduation, like before master or before masters, or later on, before some time?
So the Master of Pharmacy is obviously the undergraduate program. And so you would do the 4 years Master of Pharmacy, then you do a year on the job training, which is called your pre-registration year. And at the end of that, you're assessed. And if you pass that, you then become a registered pharmacist. And then you can use the term pharmacist. So it's obviously a protected name, not anyone can call themselves a pharmacist. And that then will allow you to work in any of the sectors that you're interested in. So whether that's being an industrial pharmacist or working in community or working in hospital, or for instance, being a military pharmacist. But yes, you have to do the on-the-job training after your undergraduate degree. It might, sometimes you have a 5-year course, which has the registration year integrated, so you do 6 months in the middle and 6 months at the end, but it will always be either during or after your undergraduate.
Acha, so I have one more thing to ask, that is, which in my country, that is Bangladesh, we have this rule that we have to complete our registration under the government board before we start the graduation of 4-year program. So because of this, I have heard from many people that it is not wise for me to pursue my education in pharmacy field, because I could not apply for the registration before the deadline. So I thought that since I'm very passionate about learning pharmacy and being a pharmacist in near future, so because of that, I thought that would it be possible that if I continue my pharmacy education over here, and then in future I would apply for the registration outside Bangladesh?
So once you've obviously completed a pharmacy degree, certain countries have different requirements about whether or not they'll accept a degree from that institution. Obviously, Nottingham is a very well-known, globally accredited course. But obviously, if you want to be straight going into being a pharmacist, then obviously that links to the UK and Malaysia. However, if you've done, for instance, a Bangladeshi degree and you've qualified as a pharmacist, there are different options to kind of transfer. You might have to do some more on the job training. You might have to sit another exam. So different countries will have different requirements as to whether or not they'll allow you to register in that country if you've registered as a pharmacist in a different country. So most countries have some sort of transfer or some sort of training scheme for qualified pharmacists in order to adapt them to their kind of local, for instance, healthcare system and local policies and procedures.
Thank you very much. Your words were very helpful. Thank you.
Thank you, Sana. So Mashroor Ayam, can you please unmute yourself and ask your question?
Thank you, everyone, for giving me the floor. Firstly, I want to thank Dr. Georgina Marsh for this wonderful interview and wonderful session. So my aim is to go for any biochemistry or biochemical engineering degree. Still, I have 1 year in my hand to go for the undergraduate program. But my question is, if I am going to have the biochemical engineering degree or something like that, so is it possible for me to go for any pharmaceutical research? And afterwards, do I need to go for the developments of the medicine, or do I need for the go for the marketing of the medicine, please?
So if you've got biochemistry, you can go and do pharmaceutical research. That's perfectly fine. So if, for instance, you want to do a PhD, we do accept people from a range of different disciplines. So you don't just have to be a pharmacist, because a lot of our research is interdisciplinary in its nature. So doing a PhD and a research degree will accept people from lots of different backgrounds. Working in industry, pharmaceutical industry does not just employ pharmaceutical scientists and pharmacists. They employ chemists, they employ engineers. It's, you know, there's lots of different people that all have to come together. So again, you can easily work in the pharmaceutical industry if you've got a biochemistry or a biochemical engineering degree. I think it all depends on what you're interested in doing. So if you really want to work in, for instance, making medicines, so taking the drugs and making it into a tablet, making it into a new vaccine, then you might want to do something that's slightly more medical based than, say, for instance, biochemistry. If, however, you're more interested in, for instance, designing the drug or discovery of new drugs, then biochemistry, you'll probably be involved in drug discovery there. Biochemical engineering, you might be involved more in, for instance, scale up. So for instance, once I've found a process that works as a formulator, that might be small scale in a lab. But if you're working in industry, you need to mass produce things. And so it's usually the engineers who are there to kind of evaluate how to scale it up in a safe way. So having that kind of biochemical engineering degree can be really useful for that. So I think it's about understanding which kind of part of industry you want to work in. Obviously, you can be involved in pharmaceutical research. There's nothing that stops you from doing that. But if what you really want to do is usually more aligned with, say, doing pharmacy or biomedical sciences, maybe that means that those courses will suit you better. So have a look. There's lots on the internet about kind of pharmaceutical industry and what career paths are available depending on what course you do. And that might be a really useful way for you to think about what you want to study.
Thank you, Georgina Marsh.
No problem.
Next, we have Faria Alam Bushra. Can you please unmute yourself and ask your question?
Greetings, ma'am, and greetings, sir, everyone here present. Ma'am, my question is that I would love to pursue my career as a doctor, but I would love to choose a biochemistry program as my undergrad, and I would like to pursue a few job sectors there. So can I work as a pharmacist, like a biochemist, for a certain years, and then again pursue medicals after a certain year of my life? Is it possible?
So obviously biochemistry and pharmacy are two separate subjects. So it depends obviously on what you study, and it depends where you study, depending on whether or not it will be accepted. So pharmacy, yes, there are pharmacists who qualify, register as a pharmacist, sometimes even work for a little bit and then go and do a medicine degree. And depending on the university, depending on their requirements, sometimes they don't have to do a full medicine program. So again, it really depends on where you've studied, what's been involved in your course, and whether that's acknowledged as part of maybe some of the medicine. But yes, you can definitely do medicine, pharmacy, or biochemistry, and then go on to study medicine.
Okay, thank you, ma'am, so much for enlightening. Thank you.
No problem.
So, Dr. Georgina, we have a lot of questions on our chat box. I don't know if I can pick all of them, but I'd like to pick some of them at least. Mrs. Jahanara Begum just asked you, I'm a student of public health in final year. If there is any opportunity to study further related this subject, in addition, I have experience working with medicine, nutrition, education, and different vaccine trial. So she wants
MCHN, maternal child health and nutrition, nutrition education, vaccine trial, and presently in 𝐶𝐶IST project in ICD Delhi.
So, I mean, obviously, all of those things are really relevant at the moment. So, yes, there's a whole range of different PhDs that require those sort of kind of fundamental understandings of different areas. So, by all means, have a look at pharmacy PhDs. We generally post them online, the projects that we're offering. But obviously, if you've got a project that you think you particularly want to work on, then obviously feel free to submit a project proposal when you apply to do a PhD. I know that also there are master's courses available in things like public health. We don't do them in Nottingham, Malaysia, but if, for instance, you wanted to specialize in that first, then you can by all means pursue your education that way. But obviously all of those things are really important in pharmaceutical context. And so, yes, you can easily find things like degrees or even a taught master's program, for instance, in the UK that might focus on some of those areas.
Hey, Mazharul Islam asked, does the university accept distance degree earned from accredited American universities, US universities? Does the university accept?
Okay, I think any, so we need to see the degree and the name of the university. So I think, again, anyone who want to ask about entry requirement or whether your qualification will be accepted by Nottingham, Malaysia, just check with the counsellor, and the counsellor will forward the qualification to us to check. Okay.
Okay. So I think Dr. Georgina, you have already answered this question, is why the Masters of Pharmacy is 4 years other than the typical, 2 years master program that we are used to. And
Yes.
Along with that, what is the basic requirements for biomedical science? If that's a question from Lamisha, requirements for biomedical science, BSc from Bangladesh. So I think, all these questions can be better answered. You can visit the University of Nottingham, Malaysia page. That would give you specific information, not only on pharmacy and other subjects as well. We have excellent counselors available with us. So you can always get in touch with us virtually, or you can physically visit our office. Our office is open. And I think if you look at the chat box, you'll get the address. So, if you prefer a more of a face-to-face chat with an expert who would guide you through the entire process, we have that available as well. Some of the students have written that they want to study pharmacy at University of Nottingham, Malaysia campus. So well done.
Always welcome.
Always welcome. We'd always like to have you on our. Just an interesting question. Don't have to answer if you don't want to. JC Gomes asked this question very long ago, the very beginning of this session. He asked, is the virus, now by virus, I think he's definitely meaning COVID virus, lab leaked or is it natural? Dr. Georgina Marsh.
I think that's probably one of those questions where we may never know the answer to it. I think there's been a range of different analysis where actually there's evidence that possibly it could be leaked from a lab, but also likely it could be mutated from a natural source. So it's one of those things where, if you're studying a virus, obviously you have to try and find where it started, try and find maybe the patient zero. And I think at the moment, people have struggled to find that originating subject. So without finding that and looking at the original structure of the virus, looking at how it originally emerged, it's going to be very difficult to actually categorically say one way or the other. And I'm sure there's far more well-read virologists and experts on the subject who will kind of say similar things and have different opinions, but it's probably one of those things we might never actually get the answer to. So, but interesting, definitely an interesting topic of discussion.
Very interesting question. So, Mrs. Janara Begum, how you can apply and how much it would cost per year, those all informations again can be found from us. Just get in touch with us. You have our office address and you also have our virtual office address as well. So whichever you prefer. On this note, I would like to thank again Dr. Georgina Marsh and the team of University of Nottingham, those who have worked behind to get this session done. So I call an end to this. If any final note from you, Dr. Georgina.
Well, I just wanted to say, so thank you very much all for listening and thank you for tuning in. And I hope you found this kind of interesting and educational. And obviously, if you do want to know more about the University of Nottingham, Malaysia, or you do want to study the programs, then obviously reach out to the Educo team and also to us in admissions. And we're more than happy to guide you, helping you to select maybe the right program or the right course, or how you can apply what your current understanding is in order to progress your education. So I wish you all the best for the future and hopefully everyone stays safe, and thank you very much for listening.
Thank you, Georgina.
Thank you, ma'am. Thank you, sir.
Thank you. Thank you so much. Thank you. All right. Have a good one, everyone. Stay safe until our next student development program. You can always find updates on our social handles. Whether it be in YouTube or on Facebook, you would get the live session of this as well. So with that, again, stay safe, everyone, wherever you are in whichever part of the world you are. Thank you for joining another SDP from Eduko Pathways. I'm 𝐤𝐿𝐴𝑠𝑠istant 𝑃𝑒𝑟𝑜𝑓𝑒𝑠𝑠 signing off for today. Bye.
Bye, sir.